Welcome to the Genetic Alliance webinar series. My name is James O'Leary. I'm the Chief Innovation Officer with Genetic Alliance, and I'm very, very happy to be with you today to introduce our speaker for the session, Bridging the Digital Divide, the Use and Access of Health Information Technology in a Non-Technical Environment. This is certainly a timely presentation with all that's going on in meaningful use, with all this on in electronic health record implementation. This is a very exciting time. And we do have a great expert with us today, Jason Goldwater, who's the Health IT Project Manager at North at the University of Chicago. Jason, we met at the American Public Health Association meeting. He's very involved with the Health IT group there, and I think you'll find that he has a great bridge of knowledge between issues relevant to stakeholders in public health and health information technology and policy. A couple of general reminders for participants on the call. Materials can be downloaded on our website at www.geneticalliance.org/webinars. Also, participants are muted, so make sure that you use the question function on the right-hand panel of your screen to submit comments. We will have comments and questions at the end of the webinar after Jason's presentation. Also, the session is being recorded, so keep that in mind, but also that recording will be available for streaming on our website about a week after the presentation. So if you want to go back and check out some details or forward the webinar along with colleagues, we will have that up shortly. So with that, I want to thank Jason, and we'll turn over the slides to you. Jason, we'll just let you know when we can see your slides.
Okay. Okay. Can everyone see the slide? We're good? Okay. So thank you, everyone. It's great to be on the phone, and thank you, James, for the introduction. It's great to be talking to all of you again. I'm really pleased that I was invited to deliver this presentation. I know it got a very good response at the American Public Health Association annual conference in Denver last year, and I could not agree with James more, as there is more and more emphasis on health information technology and electronic health records. The issue of the digital divide has probably never become more prevalent, and certainly an understanding of what that concept means and how we can effectively deal with it really becomes significant as more and more emphasis is placed on delivering, installing, and using electronic means to communicate medical information, patient information, and clinical information. So I really want to focus the presentation on four major areas here. The first is to understand what actually defines the digital divide, and then also to really look at the question of access. And access not really in terms of just being able to use technology, but being able to use it in a manner that would best serve providers as well as patients, which leads into the next topic, which is really effective use of health IT. It's one thing to have access to technology. It's an entirely different thing to be able to use the technology in a manner that is effective in the delivery of care, and not just care, not just standardized care, but care that is high quality, care that is efficient, and care that is to some extent proactive. With the growing rate of chronic conditions amongst Americans, it's very essential that people use the functionality within health IT to really anticipate the needs of patients before they become an issue that is so severe that it requires attention that probably could have been prevented if action had been taken before. And then really to look at potential solutions. How can we actually look at ways of bridging the digital divide and using health IT in a manner that would be effective? So I want to start here with a quote, and the quote is really with John Stuart Mill, who really talked about the philosophy of utilitarianism, which is really to do what is best for society. And he really talked about as long as justice or injustice have not terminated their ever-renewing fight For the ascendancy in the affairs of mankind, human beings must be willing, when needed, to do battle for one against the other. And I think that really has a lot to offer with the concept of digital divide. That technology has become very pervasive in our society, certainly very pervasive in the marketplace. But it really becomes essential to understand how to grant everyone access to the technology, and then really how to make sure that everyone can use the technology effectively. And that's probably never been more important than in healthcare, where really the amount of information that's delivered and the amount of information that's needed is critical in really the management of care for an individual's life and for their well-being. So while we can certainly talk about the use of technology for things such as banking or shopping, it probably becomes even more important to understand this concept as it pertains to healthcare, and really to understand what can be done about it in a way that not only bridges it, but hopefully eliminates it. So what exactly is the digital divide? I think this term has been used constantly, and I don't know how many people really truly understand it. And if you really Google it, not that you need to do that now, there's about 1 million entries on it. And I think that the best definition really comes from the Office of Economic Cooperation and Development, because it really talks about, from a very broad sense of the word, what that phrase means. It refers to the gap between individuals, households, businesses, and geographic areas at different socioeconomic levels with regard to their opportunities to access information and communication technologies and to their use of the Internet for a wide variety of activities. I like this definition for two reasons, because I think it immediately refers to the obvious definition, which is the gap between those who have access and those that don't, particularly referring to the different socioeconomic levels. Clearly, somebody that's in a large city will have a greater access to technology than someone that's living in a very rural community. And most people, when they hear that concept of digital divide, that's immediately what they think of. But I like this definition for the last part of it, which it really talks about the ability to use the Internet for a wide variety of activities. Because I think that underscores a point that's not often mentioned when we talk about this term, which is, how do you use the technology once you have access to it? And how can it be used effectively and in a way in which everyone is participating in not just the design, but also the utilization? Because if we're talking about healthcare and really speaking about the use of this information to benefit individuals and to benefit society, it can't simply just be a question of access. It also has to be a question of use. The facets of the digital divide are really a confluence of factors. They deal with technical, linguistic, literacy, content, and social factors. The two that I would emphasize here really are the literacy. Because when we talk about use, literacy is one of those factors that really comes out. And one of the reasons why is because it's one thing if you present information electronically, but you do have to be able to understand what that information means. And when it comes to medical care, that really is a very crucial concept, because medical terminology can often be quite confusing, and at times it will leave a patient wondering exactly what is wrong with them and what they can do about it. So if we're talking about individuals and providers having access to technology, there has to be the ability to understand what that information is saying from a provider perspective as well as from an individual perspective. And then I think the linguistic factors really play a part in here as well. Given the growing diversity of the United States, it can't just simply be a baseline language that everyone must understand. It has to be different languages that people can relate to, and the cultural context of those languages also has to be put into play. If you're really talking about using this technology to help better someone's care, talk about the cultural factors of these different populations. Are they really inclusive of their families? What are their relationships with physicians? What do they think about doctors? What kind of care do they normally use? Those things have to be taken into consideration as well, if the technology, of course, is going to be effective. There are a lot of details and facts that can be associated with the digital divide. I think that some of these really talk about those different facets that we were just speaking about. The community health centers that have adopted an EHR, really only 38% of them can use them to electronically enter clinical notes, issue medication alerts or prompts, or monitor the medications taken by a patient. And why that's important is because medical error is one of those things where people believe health IT can help reduce or possibly eliminate. And the biggest cause of medical errors are really medication errors. So giving individuals the wrong medication, giving them too strong of a dosage, not keeping track of the medications taken by a patient, and then prescribing something that could potentially be contraindicated. So when you talk about community health centers, which are in these rural or underserved populations, when only 38% of them can use a functionality within an electronic health record to prevent the most common cause of medical error, that really indicates a problem and indicates a digital divide. The quality of online health information varies widely along several dimensions, including the accuracy, completeness, consistency, and readability. Again, I think that goes to literacy, understanding the information that's being presented. 18% of the American public speak a language other than English. 45% have limited English proficiency. Again, in the communities that are served, underserved, or rural, in which there may be a diverse population in which English is not the most common language, if you're going to bring technology to that community, you have to make sure, again, not only can they understand it, but it's in a language they can relate to. And then 49.7 million Americans have a long-lasting physical impairment, including 9.3 million that involves sight or hearing. So while it would be fine and good to think that we just go into a computer in the library and immediately start using the internet, again, it's not a question of providing access. It's being able to use the technology, which not only means you have to take into consideration literacy and linguistics, but also potentially physical impairments or sensory impairments of the individuals that are using. So we move into now the question of access. How is access really defined? Access is defined through the technical infrastructure, which is where is the available technology, effective use of the technology, and then being able to consume information rather than just producing and distributing. I've often said this. I've been involved in this area for now about 16 and a half years, and I remember the time when we first started programming websites, and people were actually typing the actual code onto a notepad application, and then having it read by a browser. That's going way back. Nowadays, you don't have to do that anymore. There are far too many applications, many of which are free, where you can design a website simply in the same manner that you can put a PowerPoint presentation together. So it's not very difficult at this point to produce and distribute information. It's a lot easier than it was back in the early 90s, before the internet became this ubiquitous term that we all start using. But it's a different aspect when you talk about consuming the information. Yes, you can produce and distribute. Are you able to consume it? Are you able to understand it? And again, the relevancy to healthcare makes it even more significant. Access is fundamental and basic to other developments, and particularly in the use of health IT. It's not, again, just being able to find out where the nearest computer is. It really involves the use of broadband or other high-throughput infrastructure. The use dial-up is slowly becoming a thing of the past. And most of the applications that can be used in healthcare, you would never be able to use with a dial-up. If you wanted to really talk about using a personal health record to monitor your information, you have to be able to understand how you would be able to access that technology in a way that provides real-time information, ability for you to monitor your health status closely, and for your ability to ask your provider if you have any questions. If you're using a dial-up line, that will take forever. Just quite honestly, it will take forever. There really has to be broadband or high-throughput access where you can receive that information quickly and efficiently. There has to be support for a multiplicity of using roles, not just involving the creation of the information, but also the dissemination and the retrieval, particularly as it is vital. If you're really communicating with individuals about something that's vital to their health, it's essential that you create it in a way that they understand, be able to disseminate it, and be ensured that the individual is able to retrieve the information and comprehend it. Recognizing the interplay of social and technical dimensions in the development of infrastructure and identifying access gaps. If you talk about the digital divide, you really have to understand in a market-driven economy what social segments are left out. Who is not getting the benefit of using this technology? There is a lot of money that's been put forward to incentivize providers to adopt electronic health records. And and this will continue all the way up till 2015. But it doesn't mean that every provider is able to access those incentives. There are providers that are left out, providers in behavioral health, providers in long-term care, providers in federally qualified health centers are left out of the incentive program. So given that is what's occurring, what do we do to shore up that gap? What is the infrastructure that needs to be put into place? What things do we have to factor in terms of the social context? What we mean by social context is that sometimes the needs of these populations within these rural or underserved communities extend just beyond immediate clinical needs. They may have behavioral health concerns. They may have frailty or aging concerns. They may have disabilities. They may need to have their activities of daily life monitored. You don't know all of the range of conditions, but what you do need to know is that the technology has to be able to record that data and provide a means for an individual or a caregiver to access it. So you have to recognize that the technical infrastructure has to be able to support all of those social elements, which leads us really to effective use. I think effective use is probably the most misunderstood or often left out concept of the digital divide, but it's absolutely critical. And when we talk about the effective use concept, we're talking about things such as carriage facilities, input and output, tools and support, content services, service access and provision, social facilitation, and governance. So what I want to do at this point now is really to go over each of these concepts and understand why effective use really becomes significant in understanding how to bridge the digital divide and really understanding what I think is probably the most crucial concept of this entire area. Carriage facilities really talks about, is a technical infrastructure enough to support the application being used? So if you're going to use an electronic health record or a personal health record or electronic prescribing or any of the functionality associated with health IT, is the technical infrastructure in your community able to support it? Do you have the ability to have broadband, or are you have some high throughput lines where you're going to be able to access the technology quickly? If you don't, then you don't have the carriage facility to support this, and you're never going to be able to use this effectively because you never would be able to access it in time. Input, output. Are the output devices required for an application available? For example, if I was able to give you a function that would indicate medication alerts on your PDA or your smartphone, it wouldn't make a lot of sense if that community didn't have wide smartphone adoption or if they didn't have any PDAs. So I don't want to do functionality for functionality's sake. I don't want to simply incorporate functionality where no one will be able to access it. I have to make sure that the output devices support what I'm designing or support what I'm promoting, because that way it will become effectively used. Tools and support. What physical supports, protocols, and other service supports are available? One of the problems sometimes is that individuals or companies will often incorporate technology into a community, and then there's limited support or limited service. And the only way to increase that service or support is obviously by paying for it. And sometimes in a community with strapped resources, that becomes difficult to do. So if you're going to incorporate or you're going to bring technology to these areas, there has to be enough physical supports or tools to support the use of this. You can't simply do it in a vacuum where you hand off the technology and walk away. It has to be a point where you're giving the technology and giving the support along with it. And then again, content service. What specifically designed content is available for a particular area? Have you looked at the usability? An application has to be intuitive. I talked about at APHA that everyone uses Facebook nowadays, and everyone uses iTunes for music. And why are Facebook and iTunes so popular? Yes, because they really took a part of our society and our culture, which is music and socialization, and used a website or used web technologies to facilitate that. But another reason why they're so popular is because they're so easy to use. Anyone can figure out iTunes really by just simply looking and working through it. And Facebook is even easier. The easier you make some technology, the easier it is to use technology, the more effective people will be with using it. Have you really looked at locally contextual requirements? Are you taking into account the language, the design, the the literacy level, the cultural sensitivities. All of these have to be incorporated into the design and into the integration. Service access and provision. Effective use really requires a robust health application infrastructure, which means that there are professionals, paraprofessionals, community support systems that all are supporting this. If it's an individual provider that has the technology within the community, that's great, but that doesn't make it effective. It has to be a community support, that everyone is participating in the process to bring that technology and utilize it. What local resources, support, and services are available for the desired application? You have to support the facilitation of the technology because implementation will not happen spontaneously. What's the required financing? Are there regulatory or financing changes needed to support an application? What will you have to do in order to bring the technology out, implement it, integrate it, and use it successfully? So one of the things that we could talk about effective use in action is, again, the infrastructure available is appropriate to the application being developed. The output devices are available and usable by the target population. You have the appropriate peripherals to support the application that are available locally. The content of the application is described and presented in a language, form, and literacy level appropriate to the local users. The service application is appropriate to the circumstances of the end user. The application includes additional provisions for capacity development. As your population changes, the application changes with it, and it's locally sufficient for a successful implementation. You don't necessarily have to go outside. You can do it locally. And then, again, there's enough financial stability to enable a regulatory framework to bring the application around. That's really what we mean by effective use. As you can hopefully see, each one of those concepts is critical. Each one of those concepts is essential. If you don't have one of those, it's very hard to make a case that the technology would be effectively used. So we can use personal health records, which is taking on a large role now because they want to have individual control over health information. So how would effective use interplay here? Well, the first is that you have widespread broadband or Wi-Fi access available to all citizens. So that would support a personal health record, being able to utilize it through a web application or being able to use it through a PDA or smartphone. A large majority of citizens have a PC or a PDA with internet access. So, yes, individuals would be able to access a personal health record if they were choosing to use it. They have access to PCs to the local library, health center, or school if they don't personally own one. The application meets acceptable standards for usability, disability, and literacy. So no matter how diverse the population, everyone would be able to use the application. Medical facilities are within a reasonable distance for end users. So again, if you're accessing your information, you have a question, you need a fund, medical facilities are within the area. So that way you're effectively using the technology to be proactive about your own health. Physicians, nurses, social workers, and other medical professionals are available either to treat or to consult based on the information within the record. The appropriate privacy and security infrastructure is in place to protect this personally identifiable information. Funding is available to enhance and update the application as the needs of the community grow. What are some potential solutions to the digital divide? It's not necessarily reaching enlightenment, but it's really understanding all of the components of this concept and being able to relate to them and then deal with each of them effectively. An approach most supportive of effective use is participatory design, in which the community and our interested stakeholders contribute to the actual design of the application. An e-health application should be built, quite honestly, in conjunction with providers, paraprofessionals, and even individuals, if appropriate. Who better to talk about what's needed in a personal health record than the individuals that would actually be using it. The application would be built with local needs in mind and would create local champions and local ownership. It would take into account these cultural norms, literacy levels, access to the entire community, and other items. But, of course, the question is, a lot of these are controlled by very large vendors. So how exactly can you participate in a process that, for all intents and purposes, seems to be closed? That's where open source really comes into play. Open source, by nature, is the source code and the application itself are available for users or stakeholders to contribute to. So even though the application is being used, that doesn't mean you can't continuously contribute to the application if you think additional functionality or changes are needed. It encourages user stakeholder participation. Modifications are made to the applications through the collective interest of the community that's supporting the application, the skill and the need. Not everyone is a coder. I understand that. But those people that have that ability can certainly take the requests of individuals who are not that technically inclined and create those into requirements that actually could be programmed into the application. Communities of users can animate the technology acquisition and implementation based on local need and demand. So again, it's turning the request into requirements into actual code. It's a transparent process. That's the best part of open source. All changes, modifications, and enhancements are shared. You can always see what's going on with the application as it's being developed. So as we look in conclusion, the digital divide really talks about, again, access, which is the most immediate need, and certainly what everyone thinks of initially. How do I get access to the technology? Is it in a manner that I'm going to be able to access it continuously? Is it going to meet all of my needs once I'm able to access it? Then effective use, which is, can I use it effectively? Is the technical infrastructure is the technical infrastructure in place? Do I have enough community support? Do I have the peripherals or the technology to be, or infrastructure or hardware to be able to support the application? Am I able to expand the application as my community needs grow? Community involvement. Everybody has to participate in the process. It has to be everyone supports the idea of bringing the technology to the community, because then everyone is able to access it and use it in a way that's effective. And then finally, participatory action. Everyone can contribute to the implementation, the integration, and the use, whether it be through an open source environment where you're actually changing the application as needed, or even through a transparent process in which everyone is aware of the technology that's available and what the technology can do. And with that, my slide presentation's over, and I would be more than happy to answer any questions that are currently on the minds of anyone.
Great, and just as a reminder, please type in your questions in the question box on the right-hand side of your screen. So Jason, to start us off with a question that was just asked, someone asked for good examples, good model systems that have done this well.
Well, I think probably the gold standard would be the Vista electronic health record, which is used within the Veterans Administration or the Veterans Hospital Administration. Vista has been an electronic health record that's been used for almost 4 decades at this point. It's completely interoperable, which means if a veteran went to a hospital in California, but they're from Maryland originally, their information would transfer over without anything being lost. It was designed by physicians, so the initial requirements were dealt with in community that continually contribute to the application itself, and that's not necessarily people that are just hardcore into programming, but they take requirements from the doctors, they take requirements from veterans, they really understand the full spectrum of needs, and then they support those by continuously refining and developing the application. The infrastructure is clearly in place within the VA hospitals to support this, and they're able to continuously expand. The Vista system is also available outside of the VA hospitals. You can submit a Freedom of Information Act request and receive access to the source code, and then there are vendor communities that will actually help support the implementation of that process. But we're still working on this to try to bring Vista out to everybody where it's much more easily accessible. But that's beginning to occur, and I think just the nature of how Vista was done and how it's continually being used within the VA hospitals really makes this kind of the gold model of how to bridge the digital divide, how to effectively use the technology, and how there's participatory action and the continual refinement of the technology itself.
So Jason, a follow-up question actually that I had is, so will Vista meet the requirements that you stated, though, about having the ability to contribute to that refinement if you're outside of the VA?
Yeah, there's several communities that already facilitate that process. So Vista has actually been installed in community health centers and in hospitals, in behavioral health hospitals, and long-term care facilities outside of the VA. It does have implementation. It is being supported. And there are communities like World Vista that really support the application and provide that at a very low cost, if any cost, to those actual users. And they could continuously refine and support the application as they're doing now, so that it means may do as soon, if not may do quicker than any of the more proprietary applications, or at least on the same time frame. Because you're talking about a private organization that has a 300 programmer and 10,000. I think the question, James, is the government and can only support Vista in a need to try to change that by making Vista open source completely, which means that it could be supported in the VA and outside of the VA that already exists that support the application now.
Great, excellent. So another question that's related to that one that was asked is, if we have already adopted a package solution, how do we effectively communicate these needs to their vendor? So I'm guessing that's asking, open access absolutely makes sense, but what if we've already gone down a different path?
Well, I think that the best approach, most vendors who are utilizing these systems, most of the bigger, larger EHR systems actually are using the Vista code at its core. So all that means is that it can be adaptable and it can be changed. So I think it's not impossible with a system that's proprietary not be able to effectively use or participate in the design. It's just a matter of communicating those requirements to the vendor themselves rather than to a larger user community. But on that note, a lot of these larger EHR systems have user communities that have grown. And they've developed in a manner and in a way to support how these changes could actually be done. Because, again, each community is different. So one EHR is not going to solve every community's needs. So if there are changes that need to be made to these larger systems, it's the ability of communicating the requirements to the vendor and then checking out these user communities to see what's been done that may be similar to the requirements that you want.
Okay, excellent. Next question is a slightly different tack. Smart use of health information technology could allow improved patient experience in the clinical setting. Have you seen any exciting examples of dynamic education?
Well, I've seen a few, yes. I think that there's still quite a ways to go there. And I think that that's something that probably, as in the next couple of years, will begin to take more shape. I think that in terms of education at the moment, is somewhat, unfortunately, taking a back seat to the need to conform these products to meaningful use. And meaningful use, for the most part, really deals with the most immediate clinical needs of a patient, with the exception of the ability to implement smoking cessation programs, which is clearly more of a health promotion effort. But again, they would only do smoking cessation if somebody was actually smoking. So although it's health promotion, they're only going to implement that functionality if they actually see somebody smoking that also has health problems. So I don't think I've seen any really dynamic learning programs at this moment. I think that the government, particularly the Office of Minority Health, has implemented some web training programs to broaden everyone's understanding of cultural competency. And they're really looking at cultural competency not just from the interactions between a provider and a patient, but really also looking at cultural competency in terms of an individual's ability to decipher and understand the medical information that's presented to them. that really gets back to effective use, because if you don't understand the medical information, it's really not any good to you. But other than that, I haven't really seen anything else.
Okay, great. And, you know, as a reminder, this actually reminds me that we did host another webinar about a collaborative project between NICHPEG, Harvard Partners, March of Dimes, and Genetic Alliance that looked at use of tablet PCs in the prenatal setting. And Genetic Alliance's role actually is to do something similar to this, you know, incorporate media, information buttons, follow-up education, things like that. So I also, you know, I'm really interested in this area.
Good.
Hey, follow-up question from an earlier question. Someone asked, I just looked at World Vista, and I wonder if it can import EMR info from other EMR data sources seamlessly.
At the moment, no. And the reason is not because of a lack of functionality within Vista. It's because the data is not completely standardized between the two systems. Vista uses the data standards that have been promulgated by the federal government and that have been discussed at some time in terms of messaging and content. But proprietary systems at the moment are only standardizing the data that they need to in order to meet meaningful use. And the reason that they're doing that is because if they were to standardize data throughout and one system could take data from another, the fear is that it would diminish the market leverage that some of these systems would have. Eventually, we will get to a point where they're fully interoperable, regardless of any, you know, fear or doubt that the market would not continue to survive or thrive. But at the moment, Vista could certainly take the information from another system and then perhaps clean it and have it transferred into their record. But the other system is not going to be able to import or export that data out, unfortunately.
Okay. Another question from my end, and just a reminder, if people have additional questions, please submit them, is if people want to get more involved in these discussions, are there, you've mentioned a couple of times groups to get involved with, where should people find these groups, what types of groups are good for different purposes, et cetera?
Mm-hmm. I think there's a few that come to mind. So World Vista is obviously one. And that really is a group that's very dedicated to the use of Vista outside of the VA, and that organization is certainly growing. I think the hard hats community, but the hard hats is kind of the technical support group for Vista. So I find that interesting, but I used to code for a living. If you don't have a lot of technical acumen, probably wouldn't be the best user group to go to. I think open source tools, which has its own website, is another great one, because that really does not just discuss Vista. It discusses all of the tools within health information technology that are open source and points to all of the different user communities that support those particular tools. So that's another one to really go to if you want a broad education. And the chief technical officer for that group is the former individual who ran the Office of the National Coordinator, Rob Kolodner, who actually was also one of the individuals that first programmed Vista way back in the late 70s. So he certainly has a wealth of knowledge with respect to these different types of technologies and how to get involved. And I think it's also a question of really looking at some conferences and what the federal government is doing. NORC just finished a study and report on open source electronic health records that hopefully will finish being cleared and will be out in the next month or two. But also there's the open source conference, there's APHA, there's the HIMSS conference in Orlando this year. There's a variety of conferences in which open source is discussed. So that's another way of potentially getting involved, even if you can't go to the conference. Much like what you're doing, James, they post their materials online.
Great. Someone has just asked if you could repeat the name or give a website to go to for the groups that you had mentioned.
I think World Vista is worldvista.org. I don't know the website off the top of my head for Open Health Tools, but Google search will certainly be able to point you in the right direction. And Hard Hats just changed their website. So again, I would just enter that into any search engine and it will take you right there. If you want to know the exact web address, I can certainly ask one of my staff, and feel free to email me and I can send that over to you.
Okay, excellent. A follow-up question from when you were talking about standards and interoperability. The person says, on the same note, I find as a patient with a chronic disease that certain of my providers who are not members of the same group cannot access the info electronically from my other provider's EMR. I have to actually get the test records, such as an office-performed PFT, and bring it to my other provider. Are there any either open source or proprietary that boast interoperability or importing? I heard MedTech can do that, but I'm
Meditech can do that, yes, but Meditech is a proprietary vendor. So their Magic system, which actually facilitates the translation of different messages into a standardized and normalized form, is available, but I don't know what the cost is associated with that. There are a couple of open source tools that really would help facilitate the standardization of data, even if it's not standardized coming out of the system. And one of them is actually called, the most popular one is called MIRTH, M-I-R-T-H, and you can find information about that at mirth.org. And that's basically an interface that serves as a translator. It takes disparate messages and normalizes them and standardizes them in a way that could be read by multiple systems. Of course, the only way to utilize that is the two systems that are communicating both have to have some form of MIRTH installed. And you know, that's just the only drawback, but that's being a drawback to any of these systems until we reach a point where everything is standardized. So, you know, that's the most, I should say, readily available open source solution. There's a cost associated with it in terms of buying the server and installing it. But then once you have that, it's a fully open source product. So you can continue to contribute. You can do redesign, recoding, make changes as necessary, which you would not be able to do with Meditech unless you ask them.
Okay, excellent. There's another question here, and I asked for a little bit of a clarification. The question is, how can the general public use health information compared to health data? What skills are going to be needed in order to begin to benefit from technology?
Well, I think it's an excellent question. I think health data in its purest form is indecipherable unless you are a statistician or a policy analyst. I think in order to effectively use information, it has to be put into a form that's decipherable. So the way people will be able to use the technology is to understand when you're designing applications or when you're implementing applications, the idea of making them usable and making them literate is extraordinarily important. And oftentimes that's left out of the process. A usable application that provides information in which somebody can actually translate and use is significant. And you do that by really understanding the needs of the community and designing or refining the application, or in some cases choosing the right application to meet those needs. That's the only way this is going to be used effectively. If you just present pure data, unless you have a background or you are familiar with medical terminology or you're familiar with how to read vital signs and other information, you're not going to be able to really utilize that or decipher it. You know, there are a lot of us that would be able to without a problem, but a good portion of the American public would not be able to. So it's really a matter of using usability concepts and literacy concepts and pedagogic concepts to really broaden that education and to utilize that information or present that information in a way that's more decipherable. And so I think as programmers and implementers and users begin to come together to decide what technology to use, those are core concepts that really have to be brought to the forefront providing better and more efficient care.
Okay, excellent. So, Jason, any other thoughts to kind of wrap things up? General thoughts on things people should focus on, what you see coming down the pipeline in the next year?
I would continue to kind of focus on meaningful use, which you brought up in your intro, James, and really see how that's going. There's a lot of discussion as to whether anybody's ever going to be able to meet all of those qualifications or all those criteria, rather. And if there are products that do, to know what products those are. I would really focus on the broadening of the open source environment as it pertains to healthcare, to really kind of understand what's out there and what could be used in communities that simply don't have the financial wherewithal to afford these $300,000, $400,000 systems. I would really look at understanding the open source process and why it is a desirable mechanism and method for effective use and participatory design. And then I would also just kind of follow what's going on within the Office of the National Coordinator for HIT. What are they going to direct next? How are the grant programs they've already funded, like the Beacon Communities or the State Health Information Exchange programs? What are they doing exactly to create interoperability, increase adoption of EHR, and then showing how the EHRs can be used or how health information technology can be used to better facilitate greater delivery and more efficient care. For the next year or for this year, that's what I would probably focus on.
Excellent. Well, I really want to thank you, Jason, for joining us today. This is amazing information. Absolutely, if people have questions, let us know, and we can connect you to Jason. I know his information is also on the web.
Right.
We do have a number of sessions coming up. On Thursday, February 10th, we have a session, 2011 Newborn Screening Clearinghouse Challenge Awards, which is a new opportunity that we're releasing. Also on Wednesday, February 23rd, a session titled Contextualizing Attachment Theory and Practice. And then finally, on Wednesday, March 2nd, a session titled Leadership and Attachment, Using the Filter of Secure Attachment to Understand Great Leadership. And both of those two last sessions are leading up to an event that Genetics Science is participating in as part of our 25th anniversary year. And we will have many other events coming out. We'll be announcing some of them coming up in the next week. So please stay tuned for more information about that. So with that, I want to thank all of our participants for joining us, all the great questions. Let's keep this conversation going. And we look forward to working with everyone on these issues in the future. Thank you very much, everyone.
Thanks, man.